Welcome back, everyone. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner and one of your co hosts for the Melanin Initiative podcast. I'm back for one topic at a time. Today, that topic is going to be physical therapy. So, oftentimes when patients come to the hospital, um, they have questions about physical therapy. And so, unlike what you see outpatient, where you work with a physical therapist and they help you build your strength up over the course of maybe 12 weeks or longer, in the hospital, that's not necessarily their objective. So the hospital is what we call an acute care setting. An acute refers to something that's typically short term, temporary, where we have a window of where this disease should take place and end. Depending on what disease we're talking about, it might be less than a month, might be 6 weeks, might be 3 months. And anything beyond that is considered chronic. So, in an acute care setting, our main objective is to get you stable and what we call medically stable and ready for discharge. So, some certain things that keep you in the hospital are like infections. If you continue to require treatments or trips to the OR or surgery, and particularly intravenous medications or IV medications, where you have a catheter somewhere in your body and we're injecting a liquid medication into your bloodstream directly. Particularly people who are going to go get discharged home or to like a regular rehab. Once we discharge you, we're going to be sending you with pills, maybe patches, but those are things that can be well managed outpatient without constant or frequent monitoring. So if you require constant or frequent monitoring, then you require to stay in the hospital. So physical therapy comes in, their objective, they might work with you over the course of 3 days, let's say, or depending on how long you're there, you might see them um, a minimum number of times. Their whole goal is they're making an assessment so that they can make a recommendation to your provider on where you should go upon discharge. Are you independent enough to go home without anything, without any assistance? Are you independent enough to go home, but maybe you need a walker or a bedside commode? Are you independent enough to go home, but maybe you need a home health aide to come and help you around the house or help you do wound care or manage your medications? Or do we need to send you to a rehab facility where you might be there for, 3 weeks or so, a few weeks, working with physical therapists pretty early in the morning to pretty late in the afternoon? But for the most part, during the day, you're going to be moving and trying to get back to some level of independence when it comes to eating, bathing, toileting, getting dressed, moving throughout your house, walking up and down stairs, sitting and standing. Uh, and so, what often the conversation that I have very often with patients is, they might be upset that they haven't seen physical therapy. It's been several days, and no one's been there to work with them. So the first thing that happens when you come to the hospital, the nursing staff is making an assessment. Is it safe for you? Is it safe for you to get up? Is it safe for us to get you up? Depending on like what your baseline when you came in, um, we might feel really. And if you're oriented, you're not there because you fell. You're not there because you're experiencing some sort of withdrawal. You're not there because you just had a procedure. Then we might feel really comfortable getting up before physical therapy comes. If not, or if the doctor has put an activity restriction in for you to be at bed rest or to not bear any weight on your legs or your arms, for instance, then we might wait for physical therapy to come in and say, okay, you can get them up. You need two people. You can get them up, but you need a walker. You can get them up, but they can only pivot to the chair, or they can only pivot to the commode, or they can get up as tolerated. And so what you're going to find is they're going to come in, they're going to work with you, and occupational therapy too. And every time they work with you, they're putting a note in the chart. And then your provider is looking at that note and saying, then they're going to come to you and say, okay, we're going to be sending you home or we're going to be sending you to rehab. And so what I typically tell patients is, even though physical therapy, they have to see the entire hospital of patients. So logistically, they just cannot spend the desired amount of time that patients have based on their understanding of physical therapy outpatient. That even though physical therapy is not there, your nursing staff is there and they're there 24/7. And so it does take some responsibly on the patient because the staff is quite busy. But if you express an interest that you want to get out of bed and you want to sit in the chair, just let us know at the beginning of the shift and we can fit that into the routine. Make sure that we have everything that we need to keep you safe to make that transfer and to have you sit in the chair as well. So typically what I tell patients is, is in the hospital, the first thing people lose track of is time. And so one thing that's pretty easy to remember and that's pretty familiar is mealtime, breakfast, lunch, and dinner. And so I tell people, anything's going to be better than laying flat. I'll come back at another time and talk about what we call deconditioning, which is what happens when you're in the hospital, spending most of your time in the bed. And so what I tell people is, anything's going to be better than laying flat in terms of your mobility and in terms of avoiding complications associated with not being ambulatory or not walking. So if all you can do is sit up, do that most of the time, or at least those 3 times of the day. If you can sit up and sit on the side of the bed, because now you have to use your core, you have to sit up straight and allow all of your lungs to expand, allow your diaphragm to expand. And we take these things for granted until we're in the hospital. But those movements, the sitting up, the being able to dangle at the side of the bed, that actually takes a lot of strength, coordination, and balance. And for many people, that's not possible. So just doing that is quite a bit of exercise. If you're in a position and you can get to the chair, that's even better than laying flat and even better than sitting on the edge of the bed. And then if you can, once in a while, get up. If you can get up to the commode, or you can actually walk to the bathroom and it's safe and the staff feel that it's safe, then that's good. That's going to get you up. That's going to be a little bit of exercise spread throughout the course of the day and the night. And then if you're also able to walk the unit, get up, walk the unit. Do it those 3 times a day at least. If you're having trouble sleeping at night, that's a great time to get some exercise and walk around. Coordinate it with your nursing staff because there are things that need to happen throughout the shift at certain times. And there are certain times that are better for the staff to be just with you because you remember they are taking care of other patients. And so if they're spending time with you and walking, making sure you're going to be safe, if they have to escort you throughout that process and make sure you get back to your room and to your bed safely, that means they're not with other patients. And so there might be a better time of the shift for them to coordinate that with you so they can really give you the dedicated time that you need. So just to recap, this was one topic at a time. That topic was physical therapy. And in the acute care setting in the hospital, the goal is for physical therapists in general, for the most part, is to make a recommendation for discharge. Every once in a while, we'll do some inpatient rehab. There are some hospitals and some units dedicated to rehab. They actually have a whole room with equipment there. But what I'm referring to is all the other floors that most people will be in. And then every once in a while, if there's like an issue with insurance or maybe someone is from another country and there's issues with documentation, maybe they don't qualify for physical therapy outpatient. And in those certain circumstances, we might do some inpatient rehab with them. That's what most people picture and that they experience outpatient. But for the majority of people, they're just going to be making a recommendation in terms of where you should go for discharge. That was one topic at a time. And I thank you for watching. I'll see you next time.